So I can show you how this procedure works. So what we do is I will make a very small incision right here on the side, just enough to be able to get this little freer in there to separate the periosteum off of the bone. And then with a very tiny burr that's not much bigger than the diameter of a pin, we'll make a cut right here in the bone, and that will allow us to take this bone segment and slide it over. We use this little jig to help us get in and align things the way we want, and we can hold it in a precise position until we get the fixation in place. So again, the bone, or what we call the metatarsal head, we slide that over, and then we'll come back here and put in some what we call temporary fixation with a couple wires, and that's going to hold the bone in this position. And you can see now that the overall alignment is going to be right back where we want it to be. Another nice thing about this procedure is that we're avoiding these joints here, here, here. None of the joints are going to be damaged at any way with this procedure, which is different than a lot of procedures that come back and they want to fuse this joint or fuse some of the other joints. And a joint has a purpose, and if we can avoid fusion, that's far better overall for your foot. Once the temporary fixation has been placed, then we put our permanent fixation with these screws, allowing us to take the temporary fixation out. And now, once these screws are in place, the bone is going to be setting solid, and we'll be able to be in that position while you're standing and walking. Typically, we'll guard that with a boot or a shoe of some type, but you can walk on it right away. We can see that the screws are flush, so you won't feel those. Then we come up here and remove the prominence from the side of the metatarsal, and now we see that the whole first ray is in alignment. A lot of times we'll do a similar cut up here in the big toe to lean that over, also with a little screw fixation, again avoiding all of these joints. The bone will naturally fill in over a handful of weeks to months, making this a nice solid bone again, leaving all of the joints intact without damaging them. And you can see the difference between prior to the procedure, the malalignment over on this side, to a corrected linear position of the first ray after the procedure.